Hi, everyone. I'm Dr. Mark Anderson, and I want to start today with a simple question. What is the very first thing you did this morning within 25 seconds of opening your eyes? Most people can't even remember. It's automatic. It's ordinary. It feels like nothing. But if you're over 60, those first 25 seconds may be the most important window of your entire day for your heart. And one common habit, something nearly everyone does without thinking, could be adding real, measurable stress to a cardiovascular system that is already working overtime at that exact moment. I've spent more than 2 decades in cardiology, and I can tell you the most heartbreaking cases I've ever seen were not the people who neglected their health. They were the careful ones, the ones who took their medication on time, watched what they ate, and walked every single day. Something they never imagined could be harmful caught up with them. And it almost always happened in the early morning hours. Before I tell you what that habit is, promise me you'll stay to the end. Because the protective routine I'll share costs nothing, takes about 90 seconds, and research suggests it could meaningfully reduce early morning cardiovascular stress for people over 60. And almost no one does it. To understand why the morning is so uniquely demanding on your heart, you have to understand what's happening biologically before your eyes even open. While you sleep, your body runs in a low-power state. Your heart rate slows. Your blood pressure drops. Your nervous system quiets down. This is the only real rest your heart gets in 24 hours. But roughly an hour before you wake, something shifts. Your body begins releasing 2 powerful hormones, cortisol and adrenaline. This is called the cortisol awakening response, and it's completely natural. It's how your body prepares you to face the day. The problem is what these hormones do to your cardiovascular system all at once. Your heart rate climbs, your blood pressure rises, your blood vessels tighten. In a healthy 35-year-old, the body handles this surge without any trouble. The vessels are flexible. The adjustment is smooth. After 60, the picture changes. Arteries become stiffer with age. The body's response is slower. And in many people, even people who feel perfectly fine, there may be plaque quietly building up inside the artery walls. Plaque they have no idea is there. When that natural morning hormone surge meets stiffer arteries and vulnerable plaque, the combination creates real mechanical stress. This is one reason cardiologists have long known that heart attacks and strokes are significantly more common between 6 a.m. and 10 a.m. than at any other time of day. Research published in major cardiology journals has shown this pattern clearly for decades. It isn't random, it's biology. And what you do in the first 25 seconds after waking either helps your heart ease into the day or asks it to do too much too fast. Let me tell you about a patient I'll call Robert. Robert was 67, a retired engineer, the kind of man who color-coded his pill organizer and walked 2 miles every morning. His last checkup was clean. His cardiologist told him he was doing everything right. One morning, Robert's alarm went off. He did exactly what he'd done every morning for decades. He silenced the alarm, sat up fast, swung his legs over the side of the bed, and stood up right away. He took 4 steps toward the bathroom and suddenly felt his chest tighten. His vision blurred. He sat down on the floor. His wife got him to the emergency room in time. Robert was lucky. Many aren't. When I reviewed his case, everything about his health looked reasonable, but no one had ever asked him about how he got out of bed. No one had ever mentioned those 25 seconds. We'll come back to Robert, because the small change we recommended made a real difference. Here it is. The habit that millions of people over 60 do every single morning without a second thought. They stand up immediately. Alarm goes off, feet hit the floor, up and moving within seconds. It feels like nothing. It's been the routine for decades. But at that precise moment, with your heart already under natural hormonal stress, standing up fast adds one more demand on top. Here's why. When you're lying flat, blood is distributed fairly evenly throughout your body. The moment you stand, gravity pulls a significant amount of blood downward toward your legs and abdomen. Your heart has to respond instantly to keep enough blood flowing to your brain. In a younger person, that reflex is fast and precise. In adults over 60, that reflex often slows down. Blood pressure can drop noticeably in the seconds after standing. Doctors call this orthostatic hypotension. You may know it as that dizzy, foggy, off-balance feeling when you first get up. Many people over 60 feel this and assume it's just part of getting older. It's extremely common, but it shouldn't be ignored. It's a signal worth paying attention to and worth mentioning to your doctor. When blood pressure drops suddenly after standing, the heart works harder to compensate. In a cardiovascular system already handling the morning hormone surge, stiffer arteries, and thicker blood, that extra demand can be meaningful. Standing up fast is the 25-second mistake, and the fix costs absolutely nothing. There's another factor that surprises most of my patients when I explain it. After 7 or 8 hours of sleep, you are genuinely dehydrated. Every single morning, no exceptions. You haven't had a drop of water all night. You've been breathing steadily for hours, losing moisture with every breath. By the time your alarm rings, your blood is thicker and more viscous than it was when you fell asleep. Picture your heart as a pump and your blood vessels as pipes. When the fluid flowing through those pipes is thin, the pump works easily. When the fluid thickens, the pump has to push harder with every beat. Research has also shown that clotting factors in the blood are naturally more active in the early morning hours. So you have a hormone surge, thicker blood, and stiffer arteries all arriving at the same moment. It's a lot to ask of any heart, especially one that's been working for more than 60 years without a break. The fix is almost comically simple. A glass of water, room temperature, before anything else. Before coffee, before medication, before checking your phone. Drinking water first thing in the morning is one of the easiest, cheapest, most underrated habits in cardiovascular health. It starts rehydrating your system, helps thin the blood, and gives your heart something to work with before the full demands of the day begin. Quick question before we move on. Do you drink a glass of water first thing in the morning before anything else? Type yes or no in the comments. I genuinely read them, and the pattern tells me a lot about what health information is actually reaching people. Now let me give you the full morning routine. I call it the 90-second heart protocol. No equipment, no cost, nothing to buy. Just a short sequence that helps your heart ease into the day. Step 1. Don't move right away. The moment your alarm goes off, stay where you are. Take 3 slow, deep breaths before anything else. In through the nose, out through the mouth. Deep and unhurried. Slow, deliberate breathing activates the parasympathetic nervous system, the calming branch of your nervous system. It helps soften the effect of the morning cortisol surge. 3 breaths, about 15 seconds. One of the simplest tools in cardiovascular health, and it's completely free. Step 2. Drink water before you stand. Keep a full glass of water on your nightstand tonight. Before your feet touch the floor, sit up halfway if you can and drink it. Room temperature, the whole glass. You now understand why. Thinner blood. Easier work for the pump. A gentler start to the day. Step 3. Sit before you stand. Roll onto your side. Push yourself up slowly. Sit on the edge of the bed with your feet hanging. Don't rush. Gently rotate your ankles in slow circles 5 times in each direction. This activates the muscle pump in your calves, which helps push blood back up toward your heart and supports a smoother blood pressure adjustment. Sit for a full 30 seconds. Then rise slowly, pressing through your legs. Stand still for about 10 seconds before you take your first step. That's the whole thing. 3 breaths, 1 glass of water, sit before you stand. About 90 seconds total, starting tomorrow morning. One more thing if you take a water pill. If you're currently taking a diuretic, a water pill, there's something worth mentioning. Diuretics help the body release extra fluid through the kidneys. They're effective and widely prescribed for blood pressure. But along with fluid, the kidneys can also release minerals like potassium and magnesium. Magnesium plays an important role in regulating the electrical signals that keep your heartbeat steady. When those levels drop quietly, which can happen with long-term diuretic use, some people notice palpitations or irregular rhythms, often most noticeable in the morning. Please don't stop any medication, but at your next appointment, it's worth asking your doctor whether checking your magnesium and potassium levels would be appropriate for you. It's a quick blood test, and the information can be genuinely useful. What happened with Robert? I promised I'd come back to Robert. In his recovery room, we talked about his morning routine. He described it just as I expected. Alarm, straight up, straight to the bathroom. Every morning for years. We made 3 small changes before he went home. A glass of water on the nightstand, the 3-breath rule, and sitting on the edge of the bed before standing. 6 months later, at his follow-up, Robert told me the dizziness he'd felt for years, the dizziness he'd always assumed was just aging, had faded significantly. His morning blood pressure readings had improved. He asked me a question I hear often. Why didn't anyone tell me this sooner? I didn't have a great answer, but I'll tell you what I told him. The information exists, the research exists, and the habit itself costs nothing. It just needs to reach the people who need it. The morning is the most demanding window of the day for your heart after 60. Cortisol and adrenaline rise before you're even awake. Your blood is at its thickest. Your arteries are at their stiffest. And standing up fast adds a sudden blood pressure shift on top of all of it. The fix is 3 steps. 3 breaths before you move. 1 glass of water before you stand. Sit on the edge of the bed for 30 seconds before rising slowly. Here's what I'm asking you to do today. Just one thing. Put a glass of water on your nightstand tonight. The rest will follow. Which part of this surprised you most? Let me know in the comments. And if this helped you, share it. There's someone in your life who wakes up every morning exactly the way Robert used to. This video might reach them at just the right moment. If you haven't subscribed yet, please do. Every week I share honest, research-based information about what your body needs after 60. And please remember, this is general health information, not personal medical advice. Before changing any medication or routine, talk with your own doctor. They know your history. Bring this conversation to them. That's where good medicine always begins. Take care of your heart. It's been working for you every minute of every day. Give it 90 good seconds tomorrow morning. It's a more than fair trade.